In 1978, my grandfather, Dr. Howard DeBosse Giles, passed away, leaving behind a library of more than 200 medical books. I was very young, so I never really got to know him. Today, I'm opening one of those books to try to discover a little more about the man who owned it. I'm Lisa, and this is Finding Dr. Giles. This is book number 1, Syphilis in the Negro, a handbook for the general practitioner. This was published in 1942, written by Dr. H.H. Hazen, who was a white professor of dermatology and syphilology at Howard University. This is interesting because this was published by the U.S. Public Health Service, and it has the Surgeon General's name in it, Thomas Parran. Chapters: Incidence, Prevalence, and Trend, Pathology and Clinical Course, Diagnosis, Treatment, Prophylaxis, References, and so forth. This is actually in very good condition. All the pages are intact. There are charts. There are photographs of genitals in here. I will not show that, but I'll show you some of the others. Skin conditions. Here's some photographs showing how it manifests on the skin. This was 20 cents when it was published in 1942. Some other photographs. When I first saw this book, the title in itself, Syphilis in the Negro, of course my first thought was, okay, was there a belief that syphilis manifested differently in Negroes or blacks than other races? And apparently the answer is yes. More photographs. So I did some internet sleuthing, and syphilis apparently was considered a major public health crisis and national security threat. This was World War II era America, and apparently when the United States entered World War II, the military began selective service screenings. Draft physicals revealed that hundreds of thousands of men had untreated syphilis, making venereal disease one of the leading causes of draft rejections. Incredible. Penicillin was just beginning to be tested for syphilis and was not yet widely available. So apparently it was believed that, including the author of this, Dr. Hazen, believed that black patients were more prone to cardiovascular syphilis, to have heart damage from syphilis, where white patients were believed to be susceptible to neurosyphilis, or their brain apparently. And it was believed that black individuals had simpler central nervous systems that were less prone to syphilitic degradation. So apparently the author of this, Dr. Henry Hazen, he was connected to the Tuskegee experiments, directly involved in the early regional syphilis surveys funded by the Rosenwald Fund in the late 1920s and early 1930s, which set the stage for the infamous Tuskegee Syphilis Study 1932 to 1972. Incredible. Hazen served as an advisory physician to the USPHS during the setup of the Tuskegee study. This was 20 cents when it was published. It was mass-produced by the U.S. government printing office to be accessible and cheap as possible for physicians. And apparently the value today, depending on condition, is between $75 and $200. So I'm trying to be careful with it. Apparently, the Surgeon General, Dr. Thomas Parran, was a controversial figure in American public health as well. He broke radio taboos on STDs. Apparently words like syphilis and gonorrhea were not spoken on radio or printed in papers. And Dr. Parran apparently treated venereal disease as a medical issue versus a moral issue and helped break the taboo nature of those kinds of words. Interesting. So when this was published, my grandfather was born in 1899, so he would have been 43 years old. My grandfather's library syphilis is just one of the topics. He was a family practice doctor. The topics in his collection range from typhoid fever, lots of books on tuberculosis, obstetrics, just everything. So this is an interesting find. So yes, Dr. Parran, apparently, Surgeon General, listed here. Thomas Parran, Surgeon General. Thomas Parran, he apparently oversaw the Tuskegee Syphilis Study and intentionally withheld standard life-saving treatment, including penicillin, when it became widely available in the 1940s, from nearly 400 black men in Alabama to study the natural progression of untreated syphilis. Then there were also the Guatemala syphilis experiments from 1946 to 1948. So under his leadership, researchers intentionally infected Guatemalan prisoners, psychiatric patients, and sex workers with syphilis and gonorrhea without their consent to test prophylactic treatments. Disgusting. Dr. Parran's name has been removed from school buildings and academic awards, including University of Pittsburgh, as it should be. So yes, this is just one of nearly 200 books in my grandfather's collection, or over 200 books in the collection. I think the oldest book is 1859, so books that over 100 years old, and some of them have his signature in them. A lot of them have the signature of a Dr. DeForest Baker, who apparently was a homeopathic doctor, I believe, in Columbus, Ohio. And not sure how my grandfather ended up with his collection of books, but he had lots of his books in his library. The United States Public Health Service estimates that more than 500,000 new syphilis infections occur in this country each year. This estimate is based on the study of early syphilis reported under treatment by cooperating physicians in clinics between 1927 and 1933 in 34 communities with total populations of 14 million. In the case of syphilis and gonorrhea, as with other communicable diseases, the committee's report continues. The best and surest method of prevention of infection is the avoidance of exposure. Educational, religious, sociologic, and legal activities which tend to prevent exposure to infection are of great importance. So when I received these books and started going through and kind of cataloging the titles just to see what I had, I was discovering that I was learning something about my grandfather that I never knew. I mean, of course, I knew he was a doctor, and I had no idea the breadth of knowledge, or I was so young when he passed that I didn't really think about all of the knowledge that he had. And when I had access to all the different books in his library, it becomes evident. And every book tells a story, and I'm just getting to know my grandfather through these books. So every episode that I do with these books brings me a little bit closer to knowing the man behind these books, and I would love to hear your comments and any knowledge that you have about the books or the time period or any of that. So feel free to leave comments, and if this book brought back a memory for you, or if you know someone who knew my grandfather, Dr. Giles, please leave a comment or reach out. Your story could help preserve his legacy. So until next time, every book tells a story, and I'm just now getting started.